All right, this might affect you. Do you suffer from sinus problems? Maybe you have trouble breathing, trouble sleeping?
Yeah, Adventist Health Castle has the doctors that can help in sickness and in health.
We have a chance now to talk more with an ear, nose, and throat specialist, better known as an ENT, and I'm joined now by Dr. Darren Wright of Adventist Health Castle. And thank you so much for joining us on Living 808.
Oh, you're welcome. Thank you.
Well, let's talk about this. A lot of people have heard of ENTs, but might not be too familiar with this specialty. So tell me more about ENT.
Well, ENT stands for ear, nose, and throat. So we basically deal with problems in the nose, sinuses, throat, and ears. Part of the specialty I enjoy so much is that we see patients of all ages, from newborns up to the very elderly, both male and female. And so it's a broad spectrum of diseases, different types of people that can be helped, and very many treatment options for the problems that do occur in that area.
Well, let's talk a little bit more about that, as in who needs to see an ENT. Do you have a lot of people who have recurring issues, or is it one-off? Do you see both?
There's probably a very big overlap between some of what primary care doctors would do and ENT. We both see ear infections, we both see sinus infections. The reason that you might see an ENT for those problems is when they become more persistent or chronic. And so you may not see an ENT for your first ear infection, but if your child has their 6th or 7th ear infection, it's probably time to see an ENT doctor. The same thing with tonsillitis. The first episode wouldn't bring you to see an ENT doctor, but after several episodes, you would want to see one and explore other options besides antibiotics to treat those problems.
Does the same go for sinuses too? If you're constantly having sinus infections, sinusitis, and other issues, would that be the time to look into scheduling an appointment with an ENT?
Sinus infections are probably the most common reason that a person might go to see any physician. There's 20% of prescriptions that are written for patients are written for sinusitis, so it's a very large problem, but not all of those patients need to see an ENT doctor. Once those infections become frequent or no longer respond to medical treatment like antibiotics or nasal sprays, antihistamines, then that patient might transition into seeing an ENT doctor to look at other treatment options for their sinus infection.
Of course, we're about to get into cold and flu season. Anything as a specialist, as an ENT, that you would like to put out there? Because I'm sure there are people who have these chronic issues every year, but maybe they wouldn't think of seeing an ENT for it.
I think those people that every winter are being treated with antibiotics 3 or 4 or 5 times for a sinus infection and may be told, well, this is just a bad cold that takes a long time to get better every winter. If that's happening year after year, I would recommend being referred to an ENT doctor to look at other potential options to treat that rather than suffering every winter for, with the prolonged cold, when in fact it may just be a chronic sinus infection that could be treated in a different way and in a way that may have more long-lasting results than again, those recurrent courses of antibiotics.
All right, Dr. Darren Wright, thank you so much for joining us from Adventist Health Castle to give us more information about ENT and what type of ailments you might be able to help.
You're welcome.
You know, I don't know, listening along, I get so many sinus infections, and think about that. And there are procedures that aren't that difficult that he said might be a better option than getting sick so many times and having to do the antibiotics. So certainly look into it, ask your doctor, check out being ENT if you might be a good candidate for that.
Yeah, thankfully I haven't had sinus infections, but occasionally I'll get that little itch and I have to spray like the Zyrtec spray and stuff like that. So yeah, I know how that is, but well, I was having a problem yesterday on the show. If you guys remember me coughing, it's because I had an itch in my nose and it was making me, I almost had to sneeze, and instead I coughed. It was like, that's the worst thing you can, it's one of the worst things you can do on television.
It's confusing your body.
Yeah, sneeze and eat, the two bad things that we do. We do one of them a lot.
We do, we do. Well, you know what? It is